The Minnesota Path to Value project is supported by a grant from the Minnesota Department of Health, Office of Rural Health and Primary Care. The purpose of the project is to provide multi-year technical assistance to selected Minnesota critical access hospitals and their communities to improve population health by sustaining an integrated clinical and community-based care delivery model. Technical assistance included education, webinars, peer-sharing calls, and group workshops, all combined with individual on-site community planning events to develop customized solutions to improve the health and well-being of the community.
Long Prairie itself is a smallish community. We have about 3,000 people that live here. About 50% of it is Spanish speaking and the remaining 50% is English speaking.
Overall, the school now serves 51% of their students come from a Spanish speaking home. That would be, I think the unique thing going on in Long Prairie in terms of diversity. That's different from other rural communities.
The community is very, I think, very open and accepting of our new cultures. We have a new building, 5 years and some change. It's really a community hospital with CentraCare supporting that. We do outpatient, inpatient, swing beds, ER, and family medicine clinic.
Going out and building those relationships, is important because it helps us think differently and how to solve, issues that we're all dealing with. Partnering with our local manufacturers to understand their healthcare needs.
At the time that we decided to do this program, we were at the very early stages of population health.
I think one of the top lessons we learned in this project is the value in mapping out a project, mapping out the needs for the project, mapping out your resources you have for the project, and then getting the right people together to take pieces and parts of that project and work to come up with our plan and then implement our plan. Discussing some of the social determinants in depth and what they can mean and what they do mean.
Our selected population that we decided to focus on was Spanish-speaking adult diabetic patients. The reason for that is because we found that our Hispanic patients were using the ER a lot for their primary care. And so they were lacking that primary care of their diabetes.
A lot of these individuals kind of go to work after they get done with work. They come here to the Wellness Center. Fitness is really important to them. Not only working out, but providing the social aspect to it as well.
For this project, we really worked on getting back to the basics, making sure we had the information needed in Spanish, making sure we had communications with our patients in Spanish through our MyChart system, making sure we had interpreting services on site. We are updating all of our signs on site with Spanish and English verbiage. We really want this facility to feel inclusive.
We coordinate care a few ways between the hospital and the clinic. One of the biggest ways is probably within the ER, where we focus on trying to get primary appointments out of the ER and make those appointments in the clinic.
Our avoidable ER visits are on the way down, the cost for those. And we are, with the MyChart in Spanish, creating more access, easier appointment setting for our patients. So we're creating more access in our clinic as well.
Some of the things that we've been doing at the Wellness Center is partnering with the UM Extension Office. We talk about eating the rainbow, ways to improve their health by exercise, eating smaller meals, eating more meals throughout the day. Another way we've done some working with this population has been to offer classes like Matter of Balance, where we do provide all the information in Spanish.
Our healthcare organization reaches out in the community and we care about the community in a way that, how can we best set ourselves up to have the best workforce, have a healthy workforce.
We'd like to get our optimal diabetic care up to 50% for our Spanish-speaking patients. And then our optimal diabetes measure, which measures things like statins and blood sugars and cholesterol and different things.
My big goals with the Wellness Center here in Long Prairie would be walking into the Wellness Center and seeing a variety of individuals working out, seeing us offering, not only classes like Matter of a Balance, Silver Splash, Silver Sneakers, and stuff like that in English, but also in Spanish. And so we wouldn't necessarily have to have 2 different classes for everything, but one uniform class where everybody would be able to participate and be active and social together.
I'm most proud that we pulled some of our numbers for our Spanish-speaking diabetic patients. And 9 months ago, we were at about 30.9% optimal care for our diabetic patients. And this morning, we are sitting at about 38% optimal care for our Spanish-speaking diabetic patients. So that's a very nice bump and a very worthwhile thought that we're making a move.